Brandon Medical Corporation's Monitect drug screen cassette is a one-step lateral flow chromatographic immunoassay test for the rapid qualitative detection of various drugs of abuse and their metabolites in human urine. The Monitect cassette device contains membrane strips onto which drug conjugates are pre-coded at specific regions known as test regions. Monitect drug screen cassette is offered in various configurations in formats from 1 to 8 drugs. The Monitect cassette may also contain adulteration tests to determine the validity of the urine sample for contamination prior to drugs of abuse testing. The Monitect drug screen cassette test is formulated for use with freshly voided human urine. Handle the urine as if it is potentially infectious. Proper handling and disposal methods should be established. For best results, do not centrifuge or add preservatives to the urine. Test immediately after sample collection, preferably the same day. Specimens that have been refrigerated must be brought to room temperature prior to testing. Previously frozen specimens must be thawed, brought to room temperature, and mixed prior to use. Frozen samples are not recommended for use with adulteration testing. The simple test procedure for Monitect drug screen cassette with adulterant tests involves the following. Before use, verify that the expiration date on the pouch is valid. Discard the device if the expiration date has been exceeded. Discard the device if the package is ripped or torn. Remove the Monitect cassette from the sealed pouch by tearing at the notch. Lay the device on a flat surface. Dispense 1 drop of urine sample into each of the oxidant, pH, specific gravity, and creatinine wells. After 1 minute, compare the colors of the oxidant, pH, creatinine, and specific gravity tests with the corresponding color blocks on the color chart included in the kit. Do not read the results after 2 minutes as the color may change. All color pads should fall within the range indicated on the color chart. If the color is outside the normal range, either high or low, possible adulteration should be considered. Proceed further with the drugs of abuse test. Draw the urine sample into the pipette and dispense 3 full drops into each sample well indicated by the S. Avoid adding drops that contain air, since air bubbles may cause an uneven flow or prevent the flow of the sample onto the test strip. Negative results are ready to interpret once the control bands C form. Any colored band that can be seen visually, no matter how faint, is a negative result. Presumptive positive results can be interpreted once the control bands C form and the membrane background clears in 5 minutes or less. A presumptive positive result will show no band in the specific test area. Results are stable and may be interpreted for up to 15 minutes after the control bands C form. When no band appears in the control region, the test is invalid, even if there is a band in the test region. In this event, repeat the test with a new device. If results are to be confirmed, follow the standard chain of custody procedures. It is important to read each test independently. Do not compare color intensity of one test to another. Samples with faint test bands at the test regions should be considered negative. Substances in certain foods and/or medications may interfere with the test and cause a cross-reaction. We recommend that samples indicating a presumptive positive result be confirmed with a more specific quantitative method, gas chromatography mass spectrometry. Monitect controls are available for purchase from Brandon Medical Corporation. The use of other commercially produced urine controls is not recommended since these do not contain analytes specific to our products. For more information or technical assistance, please review your Monitect package insert. Call our toll-free number 1-866-468-3287, our worldwide number 1-949-598-7166, or consult our website www.brandonmedical.com.